Hello friends, welcome to my YouTube channel. This is a small topic regarding chemical burns. The information explained in this video is taken from two surgical textbooks, Sadiston and Bailey and Love. Let's get started. Chemical burns. Chemical burns can happen due to accidental contact with industrial chemicals and household chemicals. And they cause physical damage to skin directly and toxic signs and symptoms if they get absorbed systemically. Now, predominantly there are two types of chemicals. They are acids and alkalis. Acids are relatively less dangerous and alkalis are relatively more dangerous than acids. Why is that so? Because body proteins undergo coagulative necrosis and they form hard eschar. And because of formation of hard eschar, there is no deeper penetration of wound. On the other hand, body proteins undergo liquefactive necrosis and they form alkaline proteinates. These are soluble and they will cause deeper penetration of wound. Let's know about hydrofluoric acid burns. Hydrofluoric acid will cause corrosion of skin. Hydrofluoric acid combines with calcium and magnesium and tissues and forms salts. This leads to a painful wound. If hydrofluoric acid gets absorbed systemically, fluoride ions combines with calcium in blood and this leads to decreased free serum calcium causing hypocalcemia. This may cause arrhythmias. Coming to management of hydrofluoric acid burns, we use calcium gluconate gel. We apply it locally over the wound. This will remove fluoride ions and this will decrease pain. If pain is not relieved by local application, we can go for intravenous or even intraarterial injections also. Management of chemical burns. First thing to do in the management of chemical burns is removal of contaminated clothing and jewelry. Second thing to do is to do copious irrigation of wound with water. Around 15 to 20 liters of water is usually used, and this irrigation is done till wound pH becomes normal, that is 7 to 7.5. And there is an exception to this rule. In cases of solid chemicals or dry powders, we don't irrigate the wound first. First we remove those solid chemicals with forceps or with brush, followed by irrigation. Because if you irrigate a solid chemical, this will cause further a chemical reaction and it will further damage the skin. And the third step is to do fluid resuscitation. That is similar to any burns patient, we give fluids, IV fluids. And the next step is management of wound. First, we excise the necrotic part. Second, after excising the necrotic part, we apply antimicrobial ointment or gel. Later, we apply graft, that is split skin graft or flap for faster healing. Thank you.